Well, when Dr. Oz visited Tampa last week, he got the chance to try out a brand new medical procedure that's being done right here in the Bay Area.
Coming up next, we'll take a closer look at the spinal surgery and what makes it so unique. When Dr. Oz made a house call to Tampa last week, it gave a local hospital a chance to show off. A few select surgeons at Florida Hospital Carrollwood are performing a type of surgery only being done in a few parts of the world. It involves a robot, small incisions, and a lot less recovery time for patients with spinal deformities. News Channel 8's Stacy Scheibel joined Dr. Oz for an up-close look at this amazing medical advancement.
This is amazing.
Dr. Oz is in awe.
Can you imagine being replaced by this?
Completely.
He's learning how a robot, smaller than a soda can, is making major spinal surgery easier, more precise, and a lot less invasive than in the past.
The frame has to be fixed to the patient.
World-renowned Tampa surgeon Dr. Antonio Castelvi is using a make-believe patient at Florida Hospital Carrollwood to show me and Dr. Oz how it works.
I had to come to Tampa to learn spine surgery.
This frame holds the patient's spine in place. The small robot attaches to it, and X-rays help guide the surgeon to the precise targets.
It takes a picture, and then the machine coordinates this with a pre-done CAT scan of the patient.
Dr. Castelvi uses the images to determine where to make the small incisions.
So we don't have to actually see inside. You know where everything is by mirroring the picture of the patient from before with this device. So now you can do what was before inconceivable surgery.
This type of surgery is being used to fix major spinal deformities. In the past, these patients would have needed a massive incision in order for a surgeon to access the spine to operate, but not anymore.
What we're going to do now is actually put a screw in.
A step Dr. Castelvi wants Dr. Oz to try.
Teach me how to do it. I get to do one. I'm so happy I came to Tampa today.
Once all of the screws are inserted into the spine,
all of them have to be lined up. The rod will go under the skin and be placed here.
And the end result looks something like this.
Absolutely amazes me. Kudos to you.
And if Dr. Oz is impressed, you can imagine how a patient feels.
The pain in my back was gone immediately.
79-year-old Mona Corgiat-Pappy suffered with degenerative disc pain for 45 years. And at her age, until this type of surgery became available, she wasn't a candidate for back surgery. The risks and recovery time were too great. Now, just a few months after surgery, she's a very satisfied customer.
I think I'm really getting to the point that I'm not going to have any pain anywhere.
Stacy Scheibel, News Channel 8.
It's pretty remarkable, isn't it?
Yeah. News Channel 8 at 5:30 is coming your way next.